Yeah, man. Big everyone who is on will watch today. It is very, I tell you, today I'm feeling cold. I'm feeling cold, and I even forgot my jumper at home, but I'm not so bad. I have my green tea here, warm green tea, to make the weather go as it is. So, welcome everyone to the platform. Welcome everyone to the platform. As you come in, you know the way we do it. You tell us where you're chilling from. You tell us where you are from. So today we want to do some things. We want to do some proper things here. We want to talk about over-the-counter medication, side effect issues of the over-the-counter medication, and some problems that occur when it comes to over-the-counter medication. So everyone who is here, big up yourself, welcome every time. And this is channel is called Benjamin the Wise Guy, but the one who is the host is called Dr. Benjamin. So whoever that is here today, whoever that is watching, you may ask any question that you feel to ask, any question that you feel to ask, any question that you feel you can bring it up. You are at you can ask, at liberty to ask. So if you're coming in and you're a new guy to the platform, always ask a question. Say, what are you doing here? We will tell you what we do here. This is a medical channel. Sometimes we do feel good, sometimes we do some things that are, so welcome everyone to the channel as we discuss. So let me push it. Let me do ABCD here, like there is something here. As people come in, we need let me prepare this. So whoever is coming in right now, I'm just in, right? The live has just started. Today we are going to talk about some over-the-counter medication. People that just love over-the-counter, they are good. They can help. So, but we need to talk about over-the-counter medication. If you are new to the channel, as we start, if you are new to the channel, you know what we do. Don't brush away. Ask a question, give us a question at the chat, and subscribe to the channel. Let's get going. New people, don't just go. For you to be a new person somewhere and you like what the person we are doing, you subscribe to this channel. Let's grow big. Let's have Jamaican uncle is here. Big up Jamaican uncle. Welcome to the platform. As people come in, it's cold in Kenya where I am. The capital is cold. I live near the capital. It's very cold and I'm feeling the cold. But I have my warm green tea here. So if you are a new person, just like Jamaican uncle is coming, blessings to you, Dr. Benjamin, and everyone in the chat. Thank you so much for tuning in. Leave your like and subscription. Don't just watch and walk away. Don't just walk away. Sometimes we don't just discuss here medical issues. Some medical issues sometimes get boring. We discuss very important issues like mental health, and on Fridays, Saturdays, we do things like feel good evening. So today we want to discuss an important topic: over-the-counter medication. Today, no matters of the heart, no matters of the heart. When we discussed matters of the heart, people are saying, the topic is so complicated. The words are big. The words are big. Today we want to discuss random things, random topics, over-the-counter medication. Over-the-counter medication are drugs that can be purchased without a prescription. Yes, because they are considered to be safe, effective when used according to instructions on the label. You hear that? They can be just given without a prescription, because every over-the-counter medication has a label on it, and it advises you on how to use them. But as it is called over-the-counter medication, there are some things that you should know. as they are over-the-counter medication, there are specific there are some specific things that you should note that are very important. Specific things that you should note that are very important. Now, like safe for self-medication. You are not a doctor, you are not a health worker, but you have a symptom and you want to use these drugs. You can go over the counter and take them. They are safe for self-medication. I can see more people coming in. If you are a new person, man, hit the like button. You know, people don't know how to double tap, how to hit the like button on the live. You click your screen, like you hit twice, double tap your screen, it will give me a like. But most often, come and watch these videos. They are enlightening. They give you more knowledge, and also subscribe to my channel. Subscribe to my channel so that one day you will not give yourself headaches to find. When I'm live, you will just get a notification. You see all the new people that are here. Tell us on the chat. Say hi to the chat. Don't just walk away by brushing out and moving on. So here we discuss about medical issues. If you're first person, I'm called Dr. Ben. That is my name, as people call me. At the channel, you see, it's called Benjamin the Wise Guy. Yes, that is the name of the channel. So don't just brush away the Aristopat. 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 How is the going, Aristopat? It's been a while. Swati Chavan says hello. Swati Chavan, how is you? Which country are you from, Swati Chavan? Please tell us which country you're from. Let's interact. Swati, I need to know my people. You know, when you come and you are a new person, I have a good memory. I will not forget you. Swati Chavan, tell us which country you are from, where you are interacting from. Let's create this to be a big family, and let's have an audience that follows, and interaction is at a par, you know, follows. Swati Chavan is from India. So Swati Chavan, meet Aristopat, meet Jamaican uncle. Here we talk. It's a big family, you know. This is like a big family. We discuss about medical issues, mental health issues concerning our mental health. We talk to them here, you know. We discuss very many issues. So if you are coming in and you are a new guy like Swati Chavan, chat, tell us where you are from. So welcome. Today, no music today. Today we are discussing important issues. We don't have music today. Today we have over-the-counter medications. We were talking about heart complications, but now we are shifting to over-the-counter medications. I can see Sha Travels is here. Great doctor and the chat. Sha Travels as we thank the Lord. We thank the Lord, and we thank you for being strong, sister. Strong big sister. We thank you for being strong and how you carried yourself through what was on. You know, losing someone who is very close is not easy, but God gave you the strength, and we saw you being strong, and we thank God for that. We thank God for that. You bless us. We had, as when we were having feel good evening, we had a session of silence and meditation for Sha Travels, and everyone commented, and we said, may God bless him at a better place. You know, Sha Travels, people love you. If you don't know, people love you. I saw it when I was doing my thing there. I saw how people commented, how people through the moment of silence. It was amazing on how people love you. Thank you so much for always supporting the channel, and yes, the strength of God will always be with us. Yes, I want to come to Africa with Jamaican uncle, but he's always sleeping. Uncle, you hear that? Aristopat always wants to come to Africa, but you are always sleeping away. Please talk to Aristopat. Blessings to you, Sha Travels. I have just finished my work, and we are so happy to see you strong. You are for the you are for what you are going through. We love you, Sha Travels. Yes, Jamaican uncle. You saw how we were at Feel Good Friday. The silence, the Sha Travels. Big up, big up, big up. I can't wait to meet you. I can't wait to see you laughing around with my wife. And my wife teaching you how to cook chapati and African delicacies. Now, yes, yes, yes. Now, Jamaican uncle, don't sleep away from Aristopat, please. Don't sleep away from Aristopat. Yeah, yeah, yeah. You are welcome, Chat Travels. Big up, big up, big up. I think there are some people that have become my family. Jamaican uncle, Sha Travels, and Sam. There is one guy called Marjay B. Yes, they are so close, and you can have a sister away from where you are, and you never know this is your sister, but it's okay. God has a purpose. Now, I love you all as well, my family, very big family. Now, let's continue about these issues of over-the-counter medication. And if anyone is coming in, don't be shy on chatting. Some people like watching and they are not texting. They are shy when it comes to chatting and asking questions. Don't be shy on chatting and asking questions. Let me put this. I'm using a phone. I'm using a phone, so I don't want calls. It will cut the live show. So I love you all as a family that comes from Sha Travels. Sha Travels, we love you too. Now, characteristics of over-the-counter medication. They are safe medications to use because under the package there are directions, but they are not so toxic. They give your body much of toxicity. Used for common minor illnesses, normal headaches after work, pain, acidity issues, those are common things. The syrups that you use for acidity issues, rashes. You have just been walking on the bush like on the grass, and then you have rashes. You are given some ointments and creams to apply to your skin. Those are called over-the-counter medication. They are clearly labeled with directions and warnings, clearly labeled. But even if they are having some warnings, they are not so adverse as the other ones that are strictly prescribed and not over the counter. Smash the button, subscribe to the channel. Thank you so much. Now, have a low potential to abuse with some exemptions. They have a low potential to abuse. There are some drugs, like yesterday I was saying, you visit someone, you visit your cousin. Your cousin maybe was prescribed with some medications that are good and they relieve pain fast because the kind of intensity of pain that your cousin was undergoing was high. So you get your cousin with a painkiller that is inclusive of cannabidiol and a codeine. And because you have a mild headache and you have just arrived, your cousin says, I have some painkillers here that I was using. Please use one. Then you take one. You get excited. You talk. Then you go and rest, my friend, because you have taken a painkiller that has cannabidiol and cannabidiol and codeine plus paracetamol. Hey, you sleep well like never. You wake up the next morning excited, feeling like, I have never felt that. What is the name of that medication? You are not prescribed. That med was for your cousin about something that was so, but you decided that because the pharmacies are so far, that painkiller, so you start being addicted. When you one day you go home, you remember the name, you start walking around pharmacies asking, I want this kind of, I want this, I want Benelin with codeine. So you find a rogue pharmacist somewhere, you find a rogue farm tech somewhere, sells for you behind the curtain there, and then you become addicted to it. So over-the-counter medications are not supposed to be addictive. They are not supposed to be addictive, Available in pharmacies, supermarkets, and retail shops. Here in Kenya, there are some times you had to go, you would go to a not even a pharmacy, a shop, a normal shop that sells normal items, and then you'll get malaria queen. But I thank God everything was straightened up. Nowadays you can't buy antibiotics on the shops, but there are some pharmacies and supermarkets. I don't know about the US because I saw Jamaican uncle buying over-the-counter medication in a supermarket, in a hypermarket. I can see more people coming in. If you're coming in and you are new, my friend, don't just be there. Interact with Share Travels on the chat. Tell us where you're watching from. Jamaican uncle here, Aristo party here. You talk to them, talk to the host, subscribe to the channel and hit the like button. I can see you are watching. You are watching and you are not chatting. Tell us where you're watching from, my friend. Dr. Shah Travel says this. Dr. Ben, should I take malaria shot or bring the pills with me to Kenya? You Shah Travels, you will meet me the first day, and I own a hospital. Why should you be worried? Come to Kenya. I will sort you out. Yes, because I don't think mosquitoes will bite you the same day you arrive in Kenya. Another thing, let me tell you one thing, and now that one has come to on point about Share Travel with malaria shots. It's not every part of Kenya that has malaria. Where I stay around the capital, it's likely, mosquitoes. It's not likely that you'll get malaria when you are at the capital. Most places that are malaria infested is around the coastal region and western region, where there's a lot of water bodies like the oceans and the lakes. People that we are in the capital, mosquitoes bite us and we never get malaria, because not all mosquitoes transmit malaria. You get? Not all mosquitoes transmit malaria. There is Anopheles mosquito, there is falciparum. Those ones are types of malaria, but there is Culex mosquito. Those ones are the ones. But in the capital, you'll never get those kind of mosquitoes. They are in the other region. So when you come, just come. When we meet, I'll sort you out with that. And don't say that when you're tired. Good to know that. And not all mosquitoes, yes, transmit malaria. There is another type of mosquito which is called Aedes, cannot transmit malaria, but it transmits something else. Aedes aegypti, it transmits dengue fever. You see. So don't worry yourselves. Ask Jamaican uncle. Uncle was here and now he's a Kenyan walking along the villages, the capital, without getting malaria. So welcome, my guys, everyone who is watching, and we are discussing and we are interacting about over-the-counter medication. Very important, because some people take medication without any they just take medications. You feel that you are having a headache and you say, now that is pneumonia. You feel like you are coughing and having fever and you say you are having pneumonia. Sorry about that. It's over-the-counter prescription as effective as prescribed medication. Yes, over-the-counter medication is whatever let me repeat that, very important. Over-the-counter medication are drugs that can be purchased without a prescription. You yourself, you feel you have a headache, you go for paracetamol. You yourself, you feel you have some rashes that have come because you are working around hay infested regions, and then you go for corticosteroids of the skin. So they are effective for the symptoms. According to yourself, they are effective for the symptoms, you see, but they ain't effective for a diagnostic criteria of disease or treatment, you know. So that is what we are going through. So the characteristics of over-the-counter medications I've gone through: one is safe for self-medication; two, used for common minor illnesses, clearly labeled with directions and warning, have a low potential for abuse, and available in pharmacies, supermarkets, and retailers. There are types of over-the-counter medications, like used to relieve the analgesics, painkillers, we call them analgesics. I can see burnout to be blessed. We burn out, we do it, we work hard, we struggle, get the blessings. Queen is in the house. Queen, welcome. Queen, welcome. We are here with the Shah Travels. We are here with Jamaican Uncle. Dorothy K is also here. Dorothy K81. Hello, doctor. She says, hello, doctor. We say, cool, and we welcome back Shah Travels, you know. We welcome back Shah Travels. Burnout, welcome. Dorothy, welcome. We are happy to see you. We are happy to interact. We are happy to talk about. We are happy to talk about everything here on openness and relaxing our mind and feeling nice. Now, over-the-counter medications are used to relieve headaches, fevers, muscle pain, arthritis pain, and toothaches, you know. And you see most of these are analgesics. Most of them are analgesics. If you notice, most of the over-the-counter over-the-counter medications, they are used to relieve symptoms. They are used to relieve symptoms. You will never find over-the-counter medication under diagnostic criteria, because the one who is over-the-counter, I really don't know about how, you know. I've not traveled a lot outside. I've not traveled a lot outside, because now my profession, you understand. And maybe I'll start traveling next year. But I see some pharmacies in the US are prescribing. A pharmacy is like a supermarket with all the drugs. You pick the drug, you give. The Dr. Ben, greetings. Hi. You know, here in Kenya, we have setups that are called chemists. And these chemists, there is a person who has been trained about drugs. There are two people. One is called a pharmtech. A pharmtech is one who has diploma in pharmacy. And a pharmacist is a person who is a graduate in pharmacy. Yes, this person has a degree, you know. So you take your license to the board of registration of which regulates the drugs, which regulates all this drug thing, yes, which regulates the pharmacies of selling the drugs, which approves you after you have done the board exam to be a pharmacist or a pharmtech. So you take your license there, then you are approved to start an outlet for this over-the-counter medication. I really don't know how it happens to the US and other places. So when you start, someone will come and give you normal symptoms, and you know, these ones I'm supposed to give this. You know, this is a trained personnel. I'm supposed to give this one, and I'm supposed to advise this person accordingly. I will not give you this. Go to a doctor first. Oh, Marjay, I've been just talking about you and you're here. Marjay, I've just been saying, Marjay, my close friend, and Marjay is here. Yes, Maje, welcome, Maje, welcome. It's Chwea. Chwea, you've gone silent for some time. How is Qatar? Hope you are doing good. Hope you are okay in Qatar. Now, I like it when I see all my friends are here. Sha Travels, Maje B, It's Chwea, Dorothy K, Jamaican Uncle, all respectable friends, all people that are I call them my dignitaries. Yeah, my dignitaries, Aristopat, all my dignitaries today are here. I thank God for these blessings, yes? So let's talk. Today we are not talking about complicated issues. It's B and it's Chwea. Today we are not talking about complicated issues. Today we are talking about normal issues, over-the-counter medication. So I was saying this. So you go to the board. They give you are licensed. The person who is licensed. As you come in, my guys, check on my dignitaries. All people that are here. Share Ramadan for my dear. Yes. Before I continue, my JB, that's very important. Let's give Share Travel hugs. Everyone who is coming, all my dignitaries today are here. Today, all my dignitaries are here, and what I want you to do, I want you to give Share Travels hugs. Let's embrace Share Travels. Let's give Share Travels warm. Thank you so much, Madhe, for reminding me that. Let's embrace the spirit of sisterhood, brotherlyhood, and she's our sister, and she was strong. Every time she was there, I was watching her. She was strong. Flowers, everyone. If you are watching me, share. Let's Chwea, Jamaican Uncle, everyone who is watching me, please throw them flowers for Share Travels. Let's pump up Share Travels with months of joy. Yes. Let's give Share Travels some joy, man. You guys, what are you waiting? I'm waiting for some hugs and flowers with emojis and some claps for our sister here. Yes. Let's get on. If you are watching me and listening, let's do it. Let's do it. Share Travel, stay strong. We love you all the time. Big up, big up, it's Chwea. Enough love, the hugs. Enough love from Jamaican Uncle. Enough love. We love Share Travels. Maje, thank you so much for reminding me that one. That is very important. And remember to go to her channel. Share the same to her channel. Let's get on. Who is that waiting and has not thrown a flower there? Yes, you are just there. You have not thrown a flower. Do it, my friend. Share Travels is my big sister. Let's do it, my people. Let's do it. Now, I was on the practice in Kenya about how medications are prescribed. So you go there over the counter, you may tell the person who is there presiding, saying, you're telling the person that I feel a headache or I have a rash, what do you think? This person is supposed to give you direction and not just sell random drugs by telling you this one is a symptom, but I'll give you this to relieve so that you can visit a physician or a doctor or a clinical officer. Here we have clinical officers. I think in the US they are called doctor's assistant, so that you can get a diagnosis for you to be treated well. You check. Very important. So most of the over-the-counter medications are like they relieve headaches, fevers, they relieve muscle pain, arthritis, they relieve toothaches, normal problems that are symptoms. There are some things that are called non-steroidal anti-inflammatory drugs. They are not steroids, but they relieve inflammation. And when you feel pain, let me tell you one thing, you feel pain because of inflammation. Because if there is something like an infection, There is something like trauma. There is Dr. Ben, and thank you very much. I love you, brothers and sisters. Thank you, Shah Travels. Thank you, Shah Travels. Welcome. So you, when inflammation is occurring, you have the mediators of inflammation, and the mediators of inflammation are supposed to be swelling, pain, redness, the most important one. And because when you are having something that is undergoing an infection or such, you release prostaglandins, and they have to come so that blood can come around the area or move fast to relieve the what is going on. So NSAIDs, non-steroidal anti-inflammatory drugs, are not steroids, but they stop those prostaglandins from coming, like Brufen, Naproxen, Diclofenac. But the problem with these drugs, if you have acidity issues, they may end up making you have ulcerations, because one thing is they corrode the layers of your stomach. They corrode the layers of your stomach, but they are good because they help you to joint pain, muscle pain, menstrual pain, and inflammation by stopping prostaglandins. You see, this is very important. Joya, thank you so much. Thank you so much for coming in and telling our sister all the love from Qatar. It is Joya from Kenya to Qatar, then showing love to Shah Travels. A good one. Today we are talking about normal things and welcoming Shah Travels back. So if you are coming, that's good to know, Dr. Ben. Yes, very important. And that's why I've said today we are talking about over-the-counter, because let me tell you one thing. Christo G, do any over-the-counter painkillers have codeine? Anything that have Christo G is our new friend, right? Christo G, welcome. If you have not subscribed to the channel, subscribe, Christo G, and always share your love to my people here. Yes, share your love to my people. Christo G is asking, hi, do any over-the-counter painkillers have codeine? No. The problem is their characteristic, we have said, they are not supposed to be addictive. They are not supposed to be addictive. So if it has codeine is a product of cocaine. You understand? Codeine is a product of cocaine. Thanks for welcoming me. Thank you, Christo G. Hope you have subscribed and you will continue interacting with my people here that you are seeing. Welcome to this channel. A very good family here where we help each other by talking out, Christo G, welcome. And I'm always here at 4:30, from 4:30 to 7 at night. You can meet me here at all that time so that we can talk. So your question goes on. So we have said anything that is addictive is not supposed to be over the counter. Codeine is a product from cocaine derivatives, and it is a drug. Anything that is cocaine derivative can give you a heart disease. You remember we talked about amphetamine, codeine, we talked about alcohol when we talked about dilated cardiomyopathy, and when we talked about hypertrophic cardiomyopathy, and yes, codeine is a product, is a derivative from the codeine line, you see. So it is added there in drugs, sometimes in theater and in some drugs to help, but under the doctor's prescription. It helps under the doctor's prescription to relieve some 1, 2, 3 things. Also, the pharmacy can get in trouble for prescribing anything with codeine. Very true. Unless, because let me tell you, in Kenya, there are some syrups that are blended with codeine. And when they are blended with codeine, pharmacies can stock them. Why? Because some can come with a prescription from a hospital that has not stocked, but a consultant has, wow, I didn't know that. Yes, Christo G didn't know that. Codeine is a delivery from the tree of cocaine. So they get it, and it is. So this person who is with a prescription can go over the counter. The over-the-counter person, the pharmtech or the pharmacist, will take the written document, photocopy it, have a copy, take the number of the hospital, and write to a book that is called DDA. DDA. So that when the board will be this DDA, someone might ask me what is DDA book? It's a specific book that is written drugs that are supposed to be only prescription, and it is called Dangerous Drug Act. Dangerous Drug Act book, where now this patient, when will come over the counter and say, I need this medication, it was written in such a hospital with such and such a doctor. The person takes, reads, photocopies the prescription, hands over the prescription to that person to go with it at home, so that when the board will be investigating their pharmacies, they will come and see, oh, there is this patient that was in such and such hospital, and the drugs here are not just sold, they are sold under regulation. So this person was given this drug because of this prescription, you know. But if you sell without a prescription and they come and they see there is no name under DDA book, there is no, but there are sales that are going on, my friend. And you know those prescriptions should be valid prescription with the doctor's numbers that are there. If you are selling without the regulation, you will be arrested. Just recently, 2 days ago, I have a friend who owns a hospital and a pharmacy, a chemist, but a clinic behind. So he told me that the board have been around and they arrested that person who was selling without prescriptions. What's the best over-the-counter substitute for codeine-based spinal injury nerve pain? Oh, the best is Christo G. No need to. Your questions are important, so don't retract them. They are educative. Don't retract them. It's okay, no problem. What's the best? Christo G asks, what's the best, strongest over-the-counter substitute for codeine-based spinal injury nerve pain? That one, in my study, let me say this. In my practice as a doc and as a medical practitioner and health practitioner, I don't say about the strongest drug. You understand? I usually don't talk about strong. I usually talk about the right drug for the right cause. You know, like for your cause that you are saying, the spinal injury nerve pain, Ricardo Malton, okay, the best friend. Ricardo, welcome, Ricardo. Welcome, Ricardo. Now, this is my attribute about drugs when it comes to pain. Please don't take it personally. I live not race. No problem, no trouble. As you say it. So, this is it. When we were talking about trigeminal nerve complications, we said nerves produce something that is called substance B, neurokinin A, and calcitonin peptide. You remember that? 3 things. So these things, the nerve is irritated, it produces. So the best way to deal with the nerve pain is to reduce the inflammation. And the best way to relieve inflammation, if paracetamol nerve pain is not like inflammatory pain of other things like muscles, because other things like muscles and other tissues, they produce prostaglandins, which brings pain by swelling and redness. Nerve pain produces pain by bringing substance P, neurokinin A, and calcitonin peptide. So, for you to relieve that pain, Life with Marie 52 said hi. Hello, Dr. Ben. Hi, Life with Marie. Welcome to the channel. I know it's your first time to come here. I met you at Jamaican's Uncle when we were having it high. Well, nice, feeling good. Jamaican Uncle, your friend today is here. Life with Marie. So I'm explaining why I don't say the strongest painkiller. I say the best for the good cause. When you give something like serotonin agonist, like sumatriptan, it increases serotonin in your brain, and the negative effect reduces neurokinin A, substance P, and the other one, which is calcitonin like peptide, which makes you feel pain from the nerves. So when this is produced like serotonin, these ones relieve. So you can take like substance P. Thank you, welcome. So you can take, if you have a doctor who knows how to reduce these things, there are some pains that are not brought down by painkillers. They are brought down for the right cause. And that's why you will go over the counter, and when you get like analgesics like steroids, they reduce inflammation and the pain goes on. Like let me say something like prednisone. There are two types. There is prednisolone and there is prednisone. Prednisone, the one that is white, is not active prednisolone. It has to go to the liver to be metabolized so that the prednisolone can work now. But there is the blue one, which is an active component. Once you take it, it starts to work. You have been having inflammatory problems like the nerve problem, the problem with the trigeminal problem, the back problem, and then like arthritis problem. You take paracetamol. It may not really work, and it's an analgesic. You take Brufen, you take naproxen. It is an non-steroid something, diclofenac. It will not really work better like you take a steroid like prednisolone. Why? Prednisolone steroids, they stop actively the compounds of inflammation. You see, paracetamol work on prostaglandins. Prednisolone as an active compound, it works on what? The active compounds that are bringing inflammation around your nerve. So the pain goes out. So Crystal G, if someone is having active pain about nerves, don't go for analgesics. No. This is what happens when through Shah Travels at pharmacy, they always refer you to check with your doctor. Yes. Okay, thank you, Dr. Ben. It's 9:49 a.m. in the morning in Jamaica. Big up, Ricardo. What I may advise people is, when you are taking analgesics, and then you go over the counter, you get analgesic. Let's say, this is an example, a codeine derivative that has paracetamol. The pain does not go away. Mostly when it is a nerve issue, you only take, it releases some prostaglandins that have been released. The nerve continues to release the pain. But because you have taken substance that may make you at least high and confuse your nervous system, you start sleeping and feeling like the pain is getting away. It has not got away. You need the right substance. anti-inflammatories like steroid that relieve the nerve from producing substance A, neurokinin, substance B, neurokinin A, and calcitonin peptide. You remember when we talked about the trigeminal nerve complication? Please go through those videos. You will learn a lot. So let's not talk about a strong drug, a strong painkiller, a strong antibiotics. Even in antibiotics, we don't talk about strong antibiotics. No, we talk about the right antibiotic for the right cause. A person is having a broad spectrum antibiotic. It will kill. We are talking about over the counter. That one will come when we are talking about prescription drugs. So let's continue. Thank you, Christo G. Thank you, Christo G. Hope you have subscribed to the channel, and hope also you are here for us as a community. You see, Life with Marie, welcome again. Welcome. I can see you there. Welcome. If you have a question, please don't fail to ask. This is a platform we interact, and we interact, and we say that everyone has to get the knowledge, So we have said about pain. That is very important that you have learned something. I know someone has learned about something when it comes to pain. So maybe I should get steroid injection. I hate needles. No, there is no. If you hate needles, there are some steroid-like drugs. Hydrocortisone. There is prednisolone. There is. I can advise you. Besides here, you can check on my email. You can email me and get my number. Most of the people here have my number. Let me text it again. It's not a must to get an injection. No. Yeah, that is my email. Anyone who can email there needs an advice. That is the email Aristopath. Most of the people have it. Now we continue. Okay, I subscribe. Thanks, Head, for your knowledge. Well explained. Thank you so much. Thank you for that. Now let's talk about something that is important. Cold and flu medicine. Cold and flu medicine. Sometimes cold and flu medicine are abused, and these ones are the ones which are very complicated, and they are ones that have even the codeine and cocaine derivatives. A combination of some things that are approved over the counter. Cold and flu medicine, some of them are not over the counter, and some of them are over the counter. So when you check, you take something like pseudoephedrine, phenylephrine. Those ones are approved compounds, because they reduce nasal swelling. You see, and we have also antihistamines, both in syrup type and in tablet types like chlorpheniramine, that is Piriton. In Kenya we call them Piriton. They are called chlorpheniramine. Diphenhydramine and loratadine. They are over the counter. There are other over the counter like this one. I'll remember it. I'll tell you. And I will advise men. I'll advise men to reduce on over-the-counter medications that have steroids. Most of the over-the-counter, go for a compound. There is a compound like cetirizine. That is a compound. If you go for cetirizine, when you are having running nose, you have gone for over-the-counter, you are given loratadine, you have given diphenhydramine, which is in tablet and syrup. That is okay. But for men that are between the ages of 28 going to 35, you are putting your risk. Steroids make your body androgens to grow fast, and you have something that is called this prostate gland. The more you use the steroid-like antihistamine, the more your prostate gland will swell. So once using them for relieving or a doctor's prescription is not bad. You understand that. It's not bad. But for you, because you like them, they relieve you faster, and you run to the over-the-counter because you will get them, like a prednisolone is over-the-counter, you will be given. But you have some glands as a man, like the prostate gland, that always grow faster when it is given some steroid-like drugs. So it's good for men to be using them, not always, but technically when it is too much, or a doctor has prescribed. Antihistamines like chlorpheniramine, diphenhydramine, and loratadine, they are okay. I know most of you use loratadine here. Diphenhydramine, I know most of you use them. But the problem is something like chlorpheniramine, which is Piriton, is addictive. Some people use Piritones when it comes to they want to sleep, and it's an antihistamine. You see, there are some things that have adverse effects. There is this drug, let me find out if it is in my system, that people use when you want to get appetite. It is called, if you know, please tell me, the drug that people use a lot. Let me find out the name. I want to surprise someone today. It is called, where is it? Not in my system. Yes, I've found it. It's in my system. It is called cyproheptadine. Always coming from cyproheptadine comes in syrup form and in tablet form. And the funny thing is, a lot of people love it. Not as an antihistamine, cyproheptadine. A lot of people like cyproheptadine, not as an antihistamine. I know someone uses it. Let me ask, have you ever used cyproheptadine as a poll? This one, people use it as an appetizer. And I don't know if you know the work of cyproheptadine. Let me ask. Most is sold under name Cipro-B, Ciproplane. Mostly in my country, people use it a lot. And I really don't know if they know what they are using it for. And there was a lady I met, and she told me that doc, you don't need to do much so that you can gain weight. You don't need to do much so that you can gain weight. You should just use cyproheptadine. And I asked that lady, who gave you that medication? And the lady told me, we just got over the counter. And then you ask over the counter, I need cyproheptadine. Then I was, that is it. Yes. So I will tell you what it's used for at the end of the topic. So let's talk about cough suppressants. Cough suppressants are like dextromethorphan. Suppress cough centers in the medulla. So when you take it, it suppresses, when the medulla is connected to your airway. So there are some cells, like the cells that are called mast cells, the mast cells. The mast cells, they release histamine. So when you release histamine is a gas. It chokes you, and then it releases that effect of coughing. And even your cells of your skin, they release histamines. So that's why when you go through When you go through some hay somewhere, some grasses somewhere, you pass through some allergies or an infection, you start getting yourself rashes. It is when histamines burn your skin, you release some rashes. You see, that's why when you go to a doctor, they give you something that is called an antihistamine, and it's always over the counter. Cetirizine is an antihistamine for nose. So when the histamine are released, some mucus come out, the light mucus. If you give them cetirizine, the mucus stop coming out because it is an antihistamine. It stops the mucus from coming. You check, it's an over the counter. Now the cough suppressants are like dextromethorphan, and there is an expectorant called guaifenesin. This one is an Asian thing, and it is approved. It loosens mucus. It loosens mucus. We have expectorants over the counter that have bromohexine. They are expectorant. Any drug that has bromohexine and salbutamol is an expectorant. It loosens some mucus, and then you remove the mucus from your chest. Most of them are over the counter. You can get them as expectorant. They help because now you cannot, as you plan to go to a doctor, you are there, you are having these problems, you can relieve yourself, because sometimes cough can make you have severe problems. You can cough until you get a severe headache and you pass out. You can cough until you injure your airway. So when you run to over the counter, it helps you to relieve these problems. Let's talk about something that is called acidity, stomach acidity. Here at cough, let me say when it comes to airway problems, expectorants and cough suppressants and histamine, and you have an under 5 child, you have an under 5 child, please take this child to a doctor. Don't go over the counter when it comes to children. Their muscles, their hormones, their bodies are still running and learning how to work out things with the environment, and you are giving this child things that are not supposed to be given, like expectorants. Take this child to a doctor. You may confuse some symptoms in a child with over-the-counter medication, and you may bring more problems. I've seen some people introducing, let me tell you one thing that I've noticed when it comes to under 5 children. You meet a child that is above 10 years that was introduced to salbutamol at a tender age. So this child, or a strong, not strong antihistamine, like some antihistamines that are like dextromethorphan, because your child was like under 5 years, and you introduce this child to salbutamol because you noticed when you give any product that has salbutamol, let me say like Ascoril as an expectorant with dexamethasone, you notice that the child responds so well and quick. Salbutamol relaxes the muscles of your airway. You know that. And at times, it gives you some effects that are not good. And what are these effects? It reduces potassium in your body, and you may have some tremors. You may have, when you take products, most of the people that have taken salbutamol, most of them may have tremors because of reduced potassium. So this child, because we started salbutamol at an early tender age, you start having problems of coping up normally because for you, greetings, Desert Channel, welcome to the chat, welcome, thank you so much for tuning in. The airway is used to salbutamol. It only relaxes when there is some little cold, some dust. Give salbutamol, it relaxes. So the child grows on like an asthmatic patient, child. In your family, you've never had any asthma problems, but now you notice that you have a child that is having this problem. Where did it come? Oh, cyproheptadine. I'll talk about it. It's a drug that many people use here in Kenya, mostly ladies. Mostly ladies. Hi, doctor. Hi, Coffee Cakes. Welcome, Coffee Cakes. Big up every time. Thank you so much for tuning in. So we are talking about over-the-counter medication, pain, So this is an important point. Let me continue as I'm welcoming people here. So your child grows, you start noticing, you go to a hospital, every drug that is given, this child is not responding. The child is coughing. Now your child is introduced to salbutamol inhaler, and the doctor tells you now your child is asthmatic. Very difficult one to pronounce, cyproheptadine. It is called Cipro-B in my country, or the drug that people say C, the drug that people call C, they call it Hep C. Now, you are the one who introduced your child over the counter with that medication that is called salbutamol, because you thought when you give your child, it is working well, but this child grows with the problems now. He goes to a hospital at 15, 16 years, is declared asthmatic. He is not asthmatic. You induced it yourself as a parent. When your children are sick, are under 5 years, Jamaican uncle in here on a different device. Thank you so much, uncle. Now, when your child is under 5 years, take your child to a pediatrician or to a doctor, because they understand these things. I once met a parent. Gotta go, Dr. Sha Travels. Nice channel. God bless you all. Christo B, thanks for coming in. Thanks. Hope you have subscribed. We need your subscription. So I met a parent one day. I examined a child who is under 6 years, and I asked this parent, what your child is not asthmatic. Why are you using inhalers? And the parent told me the long story, and I noticed that this child is being misdiagnosed. But because the parent was adamant that the child should use inhalers, because I'm also having effects of hypersensitivity. As a doctor, you only advise. You know the damage, but as you explain the damage, if this parent is not getting the point, what can you do? You refer the patient. Maybe where you refer, they know how to tackle. So I advised, and I said, I looked at the child and I knew this child is not asthmatic. The child has been mismanaged from the first day. And notice what? These inhalers and salbutamols are started from over the counter. So let's pray God that people are enlightened and may not continue misdiagnosing themselves by going over the counter. And also, let's for practitioners who are selling drugs over the counter to follow the rules and regulations, So let's continue now If you have a question, kindly ask the question. If you have a question, kindly ask the question. It's a good day, it's a nice day. That let me introduce my friends. Today we have had a good friend that is called Christo_G in the house. Christo_G in the house. Desert Channel. I don't know why you call yourself Desert Explorers. In the desert, what do you explore? Tell us. The coffee cakes loving dish, my friend. Today it is cold in Kenya and I'm having some warm here, green tea. I know you are having a coffee. You love coffee. Sha Travels, we are welcoming Sha Travels back from, she has had a ceremony, a wedding that has gone for like a week or two. And that ceremony was so tiresome. So we are giving our friend, our big sister, Sha Travel, some flowers. If you're coming in, and you have not given Sha Travels a flower, please throw a flower for Sha Travels, my friend. We can see there we have, yes, coffee cakes. I've seen you have thrown your flower with a hug there. Thank you so much, coffee cakes, for that. We have a Jamaican uncle, our emperor, our big man, always on the platform telling me don't stop. Always give people information, let the people learn, and that is what I'm doing. Coffee cakes, I can see there. Hi Marie, welcome. Live with Marie, this is what we do here. I know you met me when I was in Jamaican's Uncle channel, and there we were vibing, man. We were vibing and saying everything there. Hey, say there is a queen here, Queen Gold, Burnout to be blessed, at the background working and listening. Burnout to be blessed. As you listen to my show, as you listen to what I'm saying, be blessed where you are. And let me tell you one thing. Burnout to be blessed is a nice lady at in the US, and she told me one day, when I look at you, I remember my husband. He was called your name, Benjamin. He was funny like you. Thank you so much, Burnout to be blessed. Dorothy, I cannot forget you, man. What can I say? That is my people. Dorothy K. Bless up and big up yourself. Outer Qatar, you won't forget Chwea 25. It's Chwea 25 always coming in and asking me, how have you been, bro? How is the going? It's Chwea. Big up yourself for your big heart and your big support. It's Chwea. You will always be my bro. When you're coming to Kenya, you know what we do. When you're coming to Kenya, you know what we do. When your brother has gone for so long and is so back, Nyama Choma is the best thing to go. Don't forget that. Desert Explorer is a person willing to travel to all desert countries in the world to highlight how people live and survive. Hey, desert, you have a unique one. You have a unique one, man. Maje B, I can't forget you, Maje. All here for me, out of Jamaica, you are a darling, So don't forget that. Don't forget that. Me, the host, who is Benjamin the Wise Guy, Dr. Ben himself, the lover of life, the king of enjoyment. People call me the king of enjoyment. We party when we coming to party with the Chwea. Yes. The king of enjoyment, the doctor of medicine, but the doctor who injects you with enjoyment at times. I love you all. This is a lot of knowledge here. So receive it. Life with Marie. You know why people love the doctor. They smile, they laugh at me, and we feel good. Now, we are at antacids. The antacids. Problems of the stomach. Bro, let me tell you one thing. How was your barbecue? Coffee. Oh, you remember the night that I was out? It was fine. My friend works a doctor friend works away from outside Nairobi. It's like 8-hour drive. So the doctor had brought some students for some trip, receiving and landing. Thank you, thank you. So he told us, guys, man, I'm around. What do you say? We said, because you are around, let's meet. It's been long. That's why you saw me at night with some friends and doing some barbecue somewhere. We thank God for friendship. So let's talk about antacids over the counter. The people that have heartburns, indigestion, acid reflux. You know, the components that are allowed over the counter are like calcium carbonate, magnesium hydroxide, and aluminium hydroxide. They relieve the acidity. Acidity comes because when you release a lot of hydrogen ions in your stomach, the hydrogen ions displaces something in the sodium chloride, the salt that you take, or the sodium chloride that you have, or also calcium chloride, and takes the chloride chain. So they bind and they form hydrochloric acid. So hydrochloric acid is the one that burns you in your stomach, and it can burn you until your level of stomach is not okay. So there is this drug that is called calcium carbonate. When you take it, it dissociated hydrogen HCl by taking calcium, it's forming calcium chloride, and then the carbonate parts takes the hydrogen part. So the acidity goes down. Those are even magnesium hydrochloride, even aluminium hydrochloride. That's how you relieve your acidity problems. Laxative for treating constipation. Which kind of laxatives do you use, my friend? Which kind of laxatives? You are always using laxatives because you have constipation. By Sarkodie. There is a very good laxative that can help you. You know that? You know the pawpaw plant. Pawpaw, natural one. If you have constipation and had Zul, start eating pawpaw. One day, it is used even as a meat tenderizer. If you are buying meat and you are trying to eat every time and it is hard, before you cook it, 1 or 2 hours before you cook the meat, blend it. Pawpaw. What is pawpaw? Coffee cakes. It is pawpaw like this. It's a fruit. Pawpaw is a fruit. Pawpaw. I wish I could be using the I could show pawpaw. What is pawpaw plant? It is a doctor. Hi, how are you? Onik. Onik is here, my friends. Onik, how are you doing? Yeah. Missed you so much. Onik, hi. Pawpaw is a plant. It's a fruit. So pawpaw, when you mix it with 1 hour or 2 hours before you cook your meat, try and blend it. Let it marinate it with that. You can get it in a supermarket. Yes, it is pawpaw, that one. You can get it in a supermarket, in a grocery. Just go to any grocery and ask them, I want a pawpaw. You will get it. So let me give you a scenario and you will attest to it. The next time we are here, please come and tell me it worked or it didn't work. Get your meat, blend the pawpaw, let it be juicy, or cut some pieces, and marinate the pawpaw with what does it look like, lol? They might laugh at me, they do. Yeah, let them laugh at you, but you get the right thing. No worries, coffee cakes. It's a plant that is this size, big size like this. I don't know. I don't have a picture. Let me get a picture of a pop. I know I can show you how it is. Popo picture. I want to show coffee cakes a popo. That dust or what? In Kenya we call it pai pai. Let me get popo. Coffee cakes makes me laugh. Popo fruit. Let me get it. I show you, so that you cannot go and buy something. This is the popo. Inside it looks like this. Let me show you. And I've seen Dr. Marwa eating. Yes, Marwa eating PayPal, not PayPal, popo. Popo plant. It looks like this. Let me show coffee cakes. Popo. I want to show, and I will tell you how it is used. Popo, yes. Now the other one is this one. So it is like this one. This is the picture of a popo plant. You see that? That is the picture of popo plant. That one. But inside it looks like this. I think you've seen it. That is the picture. That is the picture there. That is the picture of popo plant. So when you go to Marie is papaya. Yes, that one. So when you go to take your meat and you need your meat tender, you need your meat to be tender, what you do is we're talking about over-the-counter medication. Yes, let me turn this one to normal. Yes. Now, what you usually do is you mean fruit. Yes. What you usually do is you cut into pieces and then you marinate with your meat. Take like you mean the fruit. Yes, the fruit. You take like 10 like an hour as it marinates. Then when you cook that meat, it will be tender. If you don't like hard meat, now eat that meat, you will see. But when you take it, it works like a good laxative. You will not have hard stool. When you eat it, you eat it. You will not have hard stool. You see, but over-the-counter medication. But there is even a drug that is made by this fruit. It is called. Let me remember it. There are drops for kids when they are having problems in their stomach. There's a drug that is made, or a drug in the counter that is made for that in a hospital. Now, there is a bisecodyl, Senna, docusetate, sodium. All these are laxatives. But simethicone is not a laxative. It is something that helps you it binds to the stomach lining. So it helps you. It's called simethicone hydrochloride. It binds to the stomach lining. So it helps you to not your stomach lining to be corroded. It helps when you have acidity. So drugs that have simethicone, as the acid is brought down by aluminium hydrochloride, magnesium calcium carbonate, magnesium hydroxide and aluminum hydrochloride, simethicone binds to the stomach lining so that the acid cannot, so they are blended so that you can feel. And T Beauty, beautiful girl in the house. Welcome T Beauty. You've gone for so long, but we meet when I'm at Marwas and we say hi, and I know you are okay. So today, T Beauty, when you are coming in, we are giving Sha Travels flowers. So you come in and we give Sha Travels flowers for doing a great job for the last, how can I call it? The last wedding that she had, and she stood as a good lady and a strong lady. So when you're coming in and you flowers for Sha Travels, dedicated, this video is flowers for Sha Travels. I will write it again. I will edit the title, over-the-counter medications, but flowers for Sha Travels for the last wedding that was. She stood as a strong lady and as a lady with dignity, and and our friend, So you do it. If you have not given Sha Travels some flowers and hearts, throw them. We thought maybe you got stuck. Lol, T. Hey, T. You see, people miss you. People miss you here. Don't go away. Don't go away. T, don't go away for long. Don't go away for so long. Don't go away for so long. Always be around. Always be around. Okay. If you have not shared some flowers for my sister Sha Travels, please share some flowers. And when you go to her channel, this week we are sharing flowers for Sha Travels, and even in the platform. So we are continuing. I've given you a meat tenderizer, a secret meat tenderizer. I've given you a secret meat tenderizer. So T Beauty, how have you been? How has been the journey? How have you been going on? Hope you've been good and everything is nice. Hope everything is nice and cool. Not cool and deadly, but nice and cool. I just can't catch your live till today. Yes, T, I've been having a lot of things. Even some people complain that I don't support them in their channel. I wish they could understand. I just wish someone could understand me. Even getting time to come, like how we are interacting. Let me just keep silent. Even my pin, the pin, monetization pin, I think it is in the postal office. I've never gone there to take it. You see, I've never. But I know I will send someone. Dr. Ben is the green one we use for meat tenderizer. So I think all of them work the same. I see my wife using them. It's hard being wanted. It's it is hard being wanted. Yes, true. So as you eat the pawpaw, you have natural lactative. Okay, we have something that is called potassium. Potassium also is a laxative, and you can get it on bananas. You can get it on bananas. So let's get to normalize these things. So if you come in and you are a new person, remember to like and follow, subscribe. Your likes give impressions out here. So let's get the likes and subscriptions, my friend. Let's get the likes on subscription. So let's continue, my friend. Let's go to constipation. Types of there is something called psyllium. It's a laxative. Lactulose. I know the laxative that people know. A lot of people know is lactulose. Lactulose is what people know. And there is something called bisacodyl and glucosate sodium. All those are over the counter that you can get, but don't overuse them. If you overuse laxative, you will diarrhea. You will have a lot of there is something called dactylose sodium, which is of salt under the name Ducolax. My friend, you continue using laxative. That's why I usually tell people eat fruits that are laxatives, because you will not have diarrhea. These ones, you can diarrhea until you have electrolyte imbalance. Your kidneys can suffer. So moderate on using laxative. Moderate on using laxative. And we have anti-diarrheal drugs. We have anti-diarrheal drugs like loperamide, oral rehydration salts that are good. I usually say, instead of using loperamide for stopping diarrhea, use oral rehydration drugs to replenish the sodium, the ions that you need, potassium. But now when you are using anti-diarrheal drugs, you are using anti-diarrhea drugs like sometimes diarrhea is a way to stop you from getting injury by your stomach, to remove the bad toxins that are there. Even in cholera, cholera also, the most thing that helps you when it comes to diarrhea is rehydration and replenishing of salts. Don't stop the diarrhea. Rehydrate. Even when you come to hospital, whatever we give you, the IV drugs we give you to rehydrate and replenish electrodes as we treat you. If you are diarrheaing, don't run always to stop the diarrhea. Rehydrate and replenish electrolytes. It's very important. Use oral rehydration salts. Use oral rehydration salts rather than stopping the diarrhea. I know some people, when you start diarrheaing, the first thing you go over the counter is to faint. It is to get loperamide. But let your doctor advise you. Antifungal topic creams, miconazole, but I usually say antifungal creams, let the doctor advise you, because sometimes you may feel that, when you have fungus infestation, you may get a wound, and then you may get an opportunistic infection that is called what? An opportunistic infection that is called bacterial, because now you have the wound. It's good. And this fungus, not all of them are treated by the same drug. You can get mycoccus. Mycoccus are treated by mycostatin, and then you may get cryptococcus. They are treated by amphotericin B, cryptococcus. And then there are several types. You can get yeast, which is treated by normal clotrimazole. So all these are not treated by the same. So it's best that you go to a doctor. Let the doctor define the kind of fungus you have for you to get the definitive treatment. You see. So you are using amphotericin B IV, and you can use fluconazole. You may destroy your yes. Endelee tu na dawa. So you are using mycostatin. Sorry, amphotericin B to treat something that can be treated with fluconazole. So when it comes to antifungals, at times I don't like getting over the counter. No, check a doctor. We have topical antibiotics. like neomycin, polymycin, Bactris, all those. You can buy them. Topical are not bad, allergy medicine and vitamin and supplements like vitamin C, vitamin D, iron, calcium, and zinc. You see. Just a minute, my guys. I check on that. Let me give that process. Yes. Let's continue. So as we continue, there are some things, even if they are over the counter, you really need to check on what you really need to check on what you are consuming. It may be over the counter, but you are talking because someone can advise you this is a fungal infection. Tinea capitis is a fungal infection. Then you go to then you go to over the counter, and then you find things are different. You go to a doctor, things become different from what you are supposed to do. So eye preparations are over the counter also. Eye preparations are over the counter also. So we will talk about something that is called, we have not finished over the counter. My time is the one which has gone. I see I have 4 minutes. I have 4 minutes to go. So there is something that is called pharmacodynamics of over the counter. We will learn about them. We will learn about how they work, so that you can know even the absorption of these drugs before we go to, we will do them tomorrow. So with anyone with any question before I get out? Anyone with any question before I get out? If you have a question, it's your time. We talk about over the counter. Yes, I'm waiting for any question before I log out. I have 3 minutes as I look here what is going on, because I have to work again, I have to see some patients. Nice. I think there is no question. Let's meet tomorrow as we continue with over the counter. I want to tell you how over the counter medication works on you, and also how over the counter medication destroy you. They are called pharmacodynamics and pharmacokinetics. So let's learn about these things. Everyone where you are, I know you are good, and blessings for everyone who is watching and always supporting. So let's meet tomorrow, guys. Have a lovely evening. Bye bye.